Hello, my name is Josh Baker. I'm a medical biochemical specialist at Lurie Children's Hospital in Chicago. I'm also a scientific advisor for HCU Network America, and I'm here today to talk to you about longitudinal data, specifically how your longitudinal data can drive change. So, what is longitudinal data? Data over time that looks at multiple subjects and multiple points in time. You might have heard your doctor talk to you about natural history data. It's the same thing that we're looking at. What is that sort of natural progression of changes for an individual over time? But not just that one individual. How do we put multiple people with the same condition together to learn more about that condition over time? Why is this important? Longitudinal data allows researchers to observe change, patterns, and developments within that same group, and then draw conclusions or learn information about that condition over time. And this is important because then, as we learn more about a condition, we can then learn what happens to that condition over time. What are other things that may happen with that condition over time as we see multiple individuals develop the same complications or healthcare outcomes? This leads to a better understanding of the homocystinuria. We can also take those individuals as they've been diagnosed and look, what are those signs and symptoms they developed before they were diagnosed? How do we take that data and go back and diagnose patients earlier? You'll hear me talk about later. Earlier treatment leads to better outcomes. So we want to find those patients as early as possible to treat. It also lets us develop those healthcare management guidelines. Okay, over time, what are those risks over time? And how can we stop disease progression or treat disease progression as early as possible? This is really important when it comes to developing new and better therapies. If researchers and pharmacology experts can look at an individual over time, learn what are those complications that may happen over time, they can develop new therapies to go back and stop and prevent earlier for better outcomes. And ultimately, hopefully, find a cure for the homocystinuria. So let's look at some examples specifically from the HCU network. So what we have learned from classical HCU, for example, from longitudinal data, we know that through newborn screening, those patients diagnosed early and maintain treatment have better outcomes. Earlier treatment has better outcomes. We also learned that there are some patients who respond well to B6 therapy and those who do not. Those who do not need low protein and medical formula for life to treat their complications. We also learned some key sort of statistical data from patients in longitudinal data. We learned that without treatment by age 10, 55% of B6 responsive patients and 82% of non-responsive patients will have a lens dislocation in their eye. Without treatment by age 15, 12% of B6 responsive patients and 27% of non-responsive patients will have some sort of blood clot or thrombolytic event in their life. So earlier sort of tracking of these patients, earlier diagnosis will help prevent some of these outcomes. Maybe even earlier treatment, new management prior to these ages will prevent these complications. These are still large percentages, even for those on treatment. We learn for cobalamin disorders because of longitudinal data. Again, those diagnosed through newborn screening and started on treatment have better outcomes. Earlier treatment means better outcomes. Patients with cobalamin should not follow a low protein diet or be on medical formula. This is a change even from 10 years ago, but because of longitudinal data, we learned that those patients on low protein diets were having worse healthcare outcomes in terms of growth and development. We then learned that patients treated on high dose hydroxycobalamin injections actually did better and did not need medical protein. So this is a change in treatment because of what we've learned from our longitudinal data. So how can you contribute? How can you help sort of grow our longitudinal data for the homocystinuria? Well, the HCU America is collecting longitudinal data through RareX. You can go in and create a profile for you or your loved one with one of the HCU disorders to better input your natural history over time so that we can used together for all patients and subjects enrolled to learn more about the homocystinuria altogether and how to treat better moving forward. There's initially a head-to-toe survey as you create a profile, but it's important not just to do this once. It's important to update at least yearly over time. On your dashboard, you'll be able to see all of your completed surveys. All of these surveys are data points over time that help us better understand the condition. It's also important when there's a major medical event to log that data, specifically when it happened and what are the implications of that, so that we know better for you and all patients involved, what are those complications over time so that we can better treat patients with homocystinuria. So please head over to Homocystinuria, Rare X platform. If you don't have a profile, please start and complete your head-to-toe assessment. For those already enrolled, thank you so much for contributing. And please make sure that you upload new data at least yearly, maybe around your birthday or your child's birthday. Go ahead, log in, complete the surveys. Even if you think nothing has changed, that's still really important data to show stability or change over time. And thank you all for contributing and listening today. Hopefully, with this longitudinal data over time, we can learn how to better treat and manage homocystinuria for a better outcome for all.